all the memory of rainy afternoons, swingy Harlem tunes, motor trips and burning lips and burning toast and prunes. How lovely it was. Thanks for the memory of candlelight and wine, castles on the Rhine, the person and moments on the Hudson River line.
Just the last name and date of birth.
How lovely it was.
As well, we have a series of summer programs for all ages. I'm teaching a series of meditation courses and relaxation courses, as well as we have our Wednesday morning movement classes where you can get a taste of Tai Chi, yoga, Nia, different gentle movement practices. Again, for all expertise levels and all ages. All right. You got it? Awesome. Okay.
There's a second one.
And there's there. Oh, so I can perform. I tend to talk pretty loud. Let me know if you have trouble hearing me. I tend to shout. Thank you all for being here, for sticking it out in the afternoon. Hopefully this will be some fun. Lot less clinical. I absolutely loved Barbara. That was wonderful. And there were so many words and instances of things that came up in your talk, in the previous talk, that really resonated with me. The word empower and inspire, these are core tenets of the HEB Body Adventure that I curate and that the Witte has put together, because basically the three pillars of that experience are health IQ, what do you know about your body, empowerment, how do you set small attainable goals, and then wellness, how do you then sustain that over time. The HEB Body Adventure, by the way, is, how many of you have been to the Witte Museum before? Yeah, so quite a few. The old HEB Science Treehouse has now been transformed to focus on physical activity, nutrition. We have cooking demonstrations, all centered around health and wellness. That's not entirely why I'm here today. I love coming and talking to this group. They asked me this year to talk a little bit about alternative medicine. My background in that, so today I just kind of wanted to go over a few things. CAM, that's a term, complementary and alternative medicine. I don't particularly like that term, and I'll explain why. But just kind of give you an overview of what are some of the national and regional trends. Very brief overview of curanderismo and folk models, or a lot of different ways to say it, popular models of diabetes. A little bit of work I've been involved in the community around this, as well as just touch on a few of the plants that are commonly, herbs and supplements that are commonly used for diabetes that we see in our community and throughout South Texas. I'll just say up front, although I've spent a lot of time studying these things, as we saw in our last, it's a pretty comprehensive list of things to keep track of, right? For a patient to keep track of. I mean, just the list of medications and strips. And then you start throwing supplements and other things in there. And so I tend to be, I'm not a clinician, I'm not a physician, I'm an anthropologist by training. So please understand that. But I actually tend to be very conservative about the ingestibles when it comes to what we call complementary and alternative medicine. I'm a lot more enthusiastic and interested in some of the mind-body yoga, meditation, relaxation, some of those practices in terms of their clinical research and benefits. And frankly, you know, because people are asking me all the time, since as you'll see, I've done some work in this area in different parts of the world. Really, most of it boils down to physical activity and basic nutrition, basically eating better and being more active. And then so I wanted to just touch on some of that, identify and that's where the HEB Body Adventure project is is a resource. I want you to be aware that it is a new resource in the community for yourselves, for your families, for your patients' families to please come, because we will be over the coming years developing a lot of. We've already developed a pretty robust curriculum, but we'll be adding some more targeted stuff for specific patient populations, cooking classes and so on like that. But I also want to leave you at least with just a website or two where there are some reliable data sources for, which you may be already familiar with, for alternative therapies. The reason, just incidentally, the reason I don't really like the term complementary and alternative is it sort of implies that it's one or the other, that people either do one or the other, and all of the research, they use conventional meds, they take their metformin and so on. All of the research that we've done shows that by far the norm is to do both, is to mix them, doing the alternative while also taking supplements and so on. And there are some very interesting misbeliefs out there and misunderstandings, which may make a lot of sense when you dig into the rationale. There's a certain logic to them, but I hadn't heard the clear sodas don't have any sugar in it. That's a new one for me. Although I did talk to a patient once who was a truck driver. Of course, he's sedentary, for hours and hours on end. And we got to talking about herbs and so on, and he said, well, that's why I drink Sprite. And I said, well, what do you mean? And he, for my diabetes. And I said, what do you mean? He said, well, I read this article that lemon was really good, and so Sprite's lemon flavored. And I said, wait a minute, wait. So he drove literally with a 2-liter bottle of Sprite in his truck. Constantly. Yeah, I know. That one hurt. So a little bit about me, my background, where I'm coming from, just because I have one of those strange winding career paths. Like I said, I'm an anthropologist by training. I got my beginnings working down on the border of Guatemala in Central America, in southern Mexico, in a place called Chiapas, with a group of indigenous Mayans who speak a language called Toholabal. Anyway, you can see where it is. I like to show this slide because I like to see if people can pick me out in the crowd. Yeah, exactly. This is, long story short, this is Doña Aurelia and her family, and she was a midwife. So essentially, I got to be very good friends with her, and she essentially apprenticed me as kind of an amateur lay midwife while I was down there, and began teaching me about medicinal plants, herbs. This is the poorest state in Mexico, poorest region. These are very little, often no running water, electricity, so on, dirt floors. So they still very much rely on traditional healing and plants as some of their primary medical care. So anyway, as a result of getting to know her and basically apprenticing with her, I got very interested in both in public health. I went down there to do archaeology. That was not my first, and then through my relationship and friendship with her, really got fascinated by this whole world of public health. And my brother's a head and neck surgeon, my dad's a veterinarian, my mom was in healthcare administration, so it was kind of like yanking me in to go into public health. But that work then led to these are just some pictures. I like to throw pictures up for fun. Just some pictures of learning about the plants with midwives. That led then to coming up back to Texas and getting very interested in what's going on in our own community and throughout South Texas. And there is a very robust and rich history of traditional healing in our communities. So I spent several years, I was on faculty, I'm still adjunct here at the Health Science Center in the Department of Family and Community Medicine. They asked me to come on board, basically to begin exploring this whole world of alternative therapies or complementary therapies. The term I like better is integrative medicine because that's a little more reflective of what people actually do. So I was involved, I guess I was here 9 years. Got involved in some projects, particularly around obesity, childhood obesity, and diabetes, finding out, and also because of my work with the midwives in the maternity unit, finding out just what folks were doing, basically listening. And that's the other slide from the last presentation. The point that I loved was that she highlighted the importance of listening, because if there's one thing, if I could boil anthropology, the whole PhD in anthropology down to one key lesson, it's basically learning how to get out of your own way, get out of your own assumptions long enough to listen and understand where your patients are coming from. It's very, very easy to judge, to make assumptions, or to just chalk it up to they're just not educated, they're not, or they don't really want to get better, and so on. Which may be true for some, I mean, let's be honest. But oftentimes, there are logics at work. And this is what I loved about anthropology. It was about learning how to listen. And I have a lot of stories about that, but one of my favorite real quick was I was working with some of the folks in the GATE lab here. And they had done a study with diabetic amputees and prosthetic limbs, and they had about 4 that they had designed, and they kind of ranged from clunky to to this high-tech bionic looking thing. They had these patients, amputees, try each of the different legs, walk across these pressure-sensitive floors, 20 video camera, all this data being fed into the biometrics analysis package, and so on. And at the end of the study, the patient could take the leg that they liked the best. And anyway, the odd thing is that at the end of the study, all of the patients chose the same leg. So they went back to the computer to try to do some statistical modeling and looking at how did it affect weight, pressure, and all of this stuff. And they couldn't find any sort of common denominator about this leg and why everyone wanted it. So they got to talk to me, and and we were sitting around, and there was this long pause, and I just looked up and I said, well, what do you think I asked him?
Did you ask him?
Yeah, I said, did you ask him? Dead silence. And then all of a sudden everybody started laughing, because they're like, oh, no, and I love them. They're dear friends, and but they're engineers, and they're trained and statisticians, so they're trained that the answer's in the numbers, So that, along with a lot of other examples I could give, it just kind of drove home to me the importance of listening and asking and not making assumptions. I'm trying to find my phone so I can watch the time, because as you may be able to tell, I like to ramble. And once I get up here talking about the Maya and those kinds of things that I'm very passionate about, this is what happens. But as a result of my work at the med school, obviously diabetes and chronic disease is just staring us in the face here, both in San Antonio and across the nation. But what's striking about this is that, from a strictly public health perspective, what's killing us, what's killing our nation, these chronic diseases, which account for, I'm not going to throw a lot of stats at you, but, chronic diseases such as type 2 diabetes, heart disease, responsible for 7 out of 10 U.S. deaths, 75% of the $2.5 trillion spent in medical care costs, and billions of dollars in lost productivity each year. But what they really, 7 out of 10 of them, of these primary causes, really boil down to lifestyle. Again, they boil down to basically portion control, eating less, eating smarter, eating more fruits and vegetables, with the caveat of all of what we saw before about, and once you're diabetic, those rules change a bit. And that's very confusing, understandably, for a lot of people, because they have been told all their lives that certain things are healthy, and then it's a whole new ballgame in many ways. So I love that approach of empowerment and saying, okay, let's step back, let's empower you. And that's what we're trying to do because at the body adventure. But because these are light, essentially boil down to how we eat, the fact that we're not very active physically, and tied in with that is unhealthy responses to stress and anxiety, depression, mental health, which often feeds the other behaviors, the sedentary lifestyles and the substance abuse, alcohol, drugs, and so on. You know, the solution is also got to be done. It's not just going to happen in a clinic. It's not going to happen through medications. It's not going to happen through herbs. There's no magic herb or magic pill. So anyway, the body adventure, where one of the wonderful things about it, and one of my goals there that I was tasked with was, I won't go into it in much detail. Please come and visit or Google us and you'll see there's some videos online. But one of the things is you check in to the body adventure and you pick a buddy. And these are real people from San Antonio that we kind of put through a 3-month education fun program. And we have camera crews film them. So when you do this, you'll get a little power pass. You'll pick a buddy and you'll get a little power pass card that you take to other activities. But by doing that also, it allows us to collect data on the back end, including BMI, physical activity, calories burned, fruit and veggie consumption, because there's a little quiz activity that you do that's real. So we're finally, for the first time in children, we're actually able to get thousands of cases. This particular map just shows the percent of our visitors ages 8 to 12 who reported no fruit consumption the previous day. And so you can see it's pretty high. Anyway, so we're finally getting some metrics to be able to look at. I also just wanted to make you aware of, again, how long the sugar, the single biggest source of extra calories in the American diet is sugar sweetened beverages. That is where we are getting basically about 50% of the extra calories over what typically we should for our age, weight, height, and so on. So I was really happy to be a part of Judge Nelson Wolf and the County Commissioner's Court really took up the charge with a bunch of other partners to develop an awareness campaign. And it's a really funny, it's a fun website. It's check it out, sugarpack.com. Anyway, we're part of the Bayer Healthy Beverage Coalition, but it has some nice tools on it as well. There's a little drink lookup tool where you can enter in a drink and it'll tell you how many sugars, grams there are, and then you can convert that into how many packets of sugar that equates to, and it's pretty eye-opening. We have another activity in the body adventure that is right here. You can't really see it very well, but it's a big giant soda cup, and the kids get up on it, and the adults, because it's for all ages, but they get up on there and you choose a drink and a size, and then you see how long on the stair stepper it's going to take you to work it off. Yeah, or you can choose water. So that's kind of an eye-opener. Anyway, so we've been trying to come up with fun ways to increase health IQ, but also empower people. Oh, wait, I have some control over these choices. I can, if not get the super size, I can go for the smaller. And we're trying to get that. We also have this anatomy table, which is really wonderful, that we've actually partnered with the medical school, so I'm rotating med students and nursing students through, and we're training them on being facilitators. And that's wonderful because the people are really bringing their experiences to it. We have real human specimens. There's 2 human hearts and so on. So again, that's just part of learning about how your body works and so on. But back to sort of alternative therapies. And again, the reason I bring up the body adventure, it's not just a sales pitch. Obviously, since I work there, I'm very passionate about it. But the thing that brought me there through this avenue of alternative medicine research was really being sold on, 1, the problem community-wide, but 2, that really the most effective tools of prevention and treatment to some extent, are the simple ones, are getting more active, having fun doing it, and changing the way you eat. through small changes, small attainable goals. So what this is just showing you at a national level. We did the survey in 2012. NIH did the survey again in 2012. We're just now getting the data in though, because it takes forever to run through those. But this is a nationally representative sample that they do every 4 or 5 years. But what I want you to see on alternative medicine use, what I want you to see, so this first one is natural products. So that the most common, so that's herbs, supplements, and so on. The rest are deep breathing, meditation, chiropractic, osteopathic, massage, so some of your body-based therapies and so on. But by far the biggest. So now if we break this natural products bar down, we just look into that bar, like what are the big ones? The biggest one is fish oil, omega-3 fatty acids. Fish oil supplements, big. I have looked at the data from 2012 or 2013, but the most recent data, fish oil is actually increased even more. Very popular. Glucosamine, echinacea, flaxseed oil, ginseng, combination herb pills. That could be just multi. Ginkgo biloba and so on, chondroitin. I know in the recent studies we've seen a few things like glucosamine's dropped down a bit, it's declined, but fish oil is still very popular. Probiotics and prebiotics and melatonin have all sort of gone up, for some reason gotten more popular. Among 18 studies of type 2 diabetes or people with metabolic syndrome, the omega-3 fatty acids have had a favorable effect on triglyceride levels relative to placebo. A small effect, but have had, in a systematic review, but had no effect on total cholesterol, HDL, LDL, fasting blood sugar, and so on. So omega-3 also has not been shown to have an effect on plasma insulin or insulin resistance in diabetics. Kind of the future of looking at herbs and supplements, really, I think dietary supplements and herbs, is one, doing these studies, controlling for baseline levels of different things in the blood and in the diet, which is very difficult and very complicated. And also looking at single nucleotide polymorphisms or which are, as you know, are DNA changes known as SNPs, to see if differences in genetics can affect the efficacy and the impact of some of these dietary supplements, and including herbs and so on. That's kind of the hot area at NIH in the division that studies alternative therapies. But my actual point showing you these is that this is national. These are national trends. You know, echinacea, ginseng, ginkgo. These are not the herbs and supplements we see locally and in South Texas. I know not entirely, but I know much fewer folks that use these. So instead, we have a very regional and localized tradition. So one of the things we have at the Body Adventure is this, are both culinary vegetable gardens and herbs, but also a medicinal plant garden that focuses on those plants that are typically used culturally in our region and throughout South Texas and the border, where I'm most familiar. But so we see something very different. Incidentally, just kind of as an aside, what is it that alternative therapies are most frequently used for? And this does hold true pretty true locally. Back pain, neck pain, joint pain, arthritis, anxiety, cholesterol, cold, common cold. Seeing a theme here?
Yeah.
Pain. Yeah. Why would that be? Why would folks be using alternative therapies or complementary therapies, or whatever you want to call them.
They don't want to get addicted to like Vicodin.
Sure, part of its addiction, fears, and so on. The other thing is pain's hard to treat. Pain's really, even when best prescribing practices are followed, which sadly our research shows is not nearly the goal. We're not hitting the goals that we should be on that front. But even with that, a large portion of patients still have uncontrolled pain. So there's a lot of room for, hey, we need more tools. So anyway, but like I said, we have a long tradition of curanderos or healers. Curanderismo is a term of healing throughout South Texas, which is really rooted. It's rooted in back Aztec and Mayan influences. Greek and Moorish influences also came over, and also a very strong influence from West Africa. There's something called Santeria, which is also from some of the religions in Western Africa, which have also infused and influenced the practice of curanderos throughout Latin America and up here in Texas. Several, and I won't go into great detail about these people, but there's just a few very famous, very popular, almost known as folk saints, really. Now these people, I had never heard of them until spending time in South Texas, but they are very widely known throughout the border and here in San Antonio, many people. Teresa is my personal favorite. She's a very famous curandera, renowned healer from northern Mexico. One of the things that is common, and it's interesting, which is common with the healers that I worked with in the Mayans that I worked with as well, is that they often have stories about they suffer some kind of a trauma or traumatic event, a near-death experience, if you will, and then have some kind of experience, dream, vision, whatever, and then when they come to, they feel a particular calling to what they do, and then they become a healer. Most of these traditional healers, certainly those I worked with, don't charge anything for their services. They have different specialties. Teresita also did not as well. But she was in a coma that lasted 3 months as a result of an attempted rape, and they actually had prepared her for burial, and she woke up and claimed to have had a vision, and at any rate, and then began giving healers. She also, however, had apprenticed with an older woman who was a healer, but she practiced in northern Mexico during the times of the dictator Porfirio Diaz. And, well, let me just kind of, you can write their books about these folks, and they are fascinating, beautiful, beautiful stories. She in particular became kind of a folk saint that people rallied around. And she was actually banished by the president of Mexico and moved to El Paso, Texas for many years, and was imprisoned and then driven out, where eventually she moved to Arizona. Niño Fidencio, another. Now you can go, I'm just mentioning these names if you haven't heard of them before, but if you go down to the west side of San Antonio, or Papa Jim's Botanica, or any of the many smaller ones throughout the city, you'll find candles and spiritual items with their pictures on them, candles to them, for prayers and so on. Niño Fidencio is very, very well known. The Fidencista Christian Church was actually recognized by the Mexican government in 1993, and there's a whole movement called Fidencista, people who believe they can channel his spirit and do healings. Again, and a lot of parallels are made between him and Jesus. He had 12 disciples, students that were very close with him, and so on. There's a lot fascinating story. Don Pedrito, if any of you ever driven south of San Antonio down to and I don't know how the locals pronounce Falfurrias. I'm sure I'm pronouncing it wrong, but I have driven down, and it's a beautiful little wide spot in the road. But Don Pedrito was another very famous healer that mostly served the poor. He was big on a lot of his treatments had these sort of ritualistic aspects to it, and a lot of them had to do with drinking water, prescribing certain glasses, how many, in ritualistic numbers, like drink 3 glasses of water 9 times a day, or for 9 days, 3 times a day, and so on. Anyway, there is a shrine to him that you can go visit, and you can see. I mean, this is just, 2 hours? I don't know. South of town, south of San Antonio. It's not far. Beautiful little chapel dedicated to him with all these testimonials and pictures and beautiful things on the wall. So why talk about these folks? Well, because we know a couple things. A lot of the studies on just kind of rates of use of alternative therapies, what we know is we have very few well-done large surveys, population surveys, particularly in Texas. Most of the surveys that we have are small, convenient samples, or they're specific clinical populations and so on. But what we know is that typically the use of folk medicine, particularly herbs, does tend to be higher in Mexican-American patients. And we certainly found that in some of our work in the primary care clinic here at the Health Science Center. And another survey, a small survey of Latinos in LA, in Los Angeles, reported upwards of 80% saying, oh yeah, sure, I take certain herbs. And so it does tend to be higher. The use of curanderos is much less. Many of them know about them and use them every now and then for certain specific conditions, but definitely not as common. This is a survey that was done back in the late 90s of probably the largest one I know of, specific to type 2 diabetics, to primary care clinics, and again, it was done through the Health Science Center and some of our regional partners. But again, a lot of different traditional plant remedies documented, but the key thing, again, and they're mixing them, they're using them both. They're not rejecting modern medicine, they're just they're merging the 2 worlds. That's definitely the most common approach. Sandy Birch, who I worked with on another diabetes study, did a survey of alternative therapy use or integrative medicine, and again found significantly lower. This was a primary care patients, but not specific to diabetics. So there were healthier individuals in this particular survey. So you definitely saw fewer percentages of herbs, but certainly a lot. And the other big thing is they're not having that conversation with the primary care provider, with the nurses. Now, this was 2002. Things have changed a bit. That discussion is happening a bit more now, thankfully, because it should, because there are real risks to some of the herbs. I mentioned my brother's a head and neck surgeon and does a lot of microvascular surgery, reconstructive stuff, and he had a patient bleed out once, and then after the fact it was really touchy for a bit, and then afterwards we got to talking, and he was telling me the story, and he said, yeah, and guess what? I found out afterwards, yeah, this guy was taking these mega doses of ginkgo biloba, which we know can thin the blood. And I said, look, this is why you got to ask these things. Like you got to have somebody asking about these things, not in a judgmental manner, but in a non-threatening, welcoming way, because they can have real impacts. So some of the stuff you see down here for diabetes, a lot of pre-packaged things like diabetina. You see these little boxes. I see them now in the Target, in the pharmacy aisles, and typically they're nopal. is one of the big ingredients, which I'll show you in a second. But some of the most common ingredients, again, these are Tronadora. That's that beautiful. We see this all over the roadsides here. It's used as along the medians and stuff as a decorative plant all over San Antonio. It's those yellow trumpet bell flowers. Very popular remedy used in Mexico in particular, but also here in South Texas for diabetes, for blood sugar control. Aloe vera, gobernadora, that's a creosote. There have been some toxicity issues reported with that. Changaro is another one, which is a particular plant. But again, so these aren't the ones that show up in our national surveys, So you really do have to talk one-on-one and ask your patients, which are saying, oh, are you taking any over-the-counter? Are you taking any supplements or herbs? What are they called? Could you show it to me? And that's important because of the whole naming practices, which I'll mention in a second. The common names often don't match the species names, where they can apply to several different species. Nopal prickly pear cactus. Talk about something that grows all over the place down here. It's actually really fascinating. There's a lot of fascinating work being done on this in Mexico. In Mexico City, there's a research group that's very active and has been for a long time in looking at studies of nopal, nopalitos, the young leaf of the prickly pear cactus, because it's used both as a traditional food. You can chop it up like green beans, kind of. I think they taste a little like green beans. I love them. They're really high in soluble plant fibers, but they're primarily known for as being able to lower your blood sugar. You can also, some people also make a licuado, they put it in the blender and blend it up. Which now, of course, if you throw in juice or something like that, you're kind of killing the blood sugar lowering qualities of that, sort of offsetting it, and that does happen. And people say, yeah, but I'm taking the, it's like, yeah, well, what are you taking it with? But it is important to know about because I would say that's one of the important ones to know about too, and to ask about, simply because some of these herbs can have an effect. They may not have a clinically beneficial effect, but they can have an effect, and they can potentially either interact or potentiate, increase the effects of, if you're, say, on metformin, for example, and lead to a hypoglycemic episode. But some of the short-term studies in Mexico have been real interesting, and they not too long ago did a meta-analysis of now these are not randomized controlled trials, but they're uncontrolled studies, and a lot of them are animal-based studies at first, where they'll use diabetic-induced rats or rabbits, I'm sorry, and then give them infusions of nopal, teas or waters, and so have them drink it, and then check and they've done this with dogs as well, and they see significant blood sugar reductions compared to plain water, and so on. And we're talking about the one study I saw, the review that I saw showed an average of about a 30 milligram reduction in serum glucose at 180 minutes post-ingestion of 500 grams. So, so I tend to, like I said, I tend to be very conservative, yet I'm a big supporter of further studying this stuff. Why would we limit ourselves to tools simply because they come from, traditions that are either foreign to us or unfamiliar to us? I say subject it to the same rigor and study as we would anything else, and give it its fair day. But the difficulties are, unfortunately, these supplements and plants, herbs in particular, are not regulated in the same manner as medicine. So they don't have to undergo, the labeling is very different. They don't have to undergo the same rigorous trials for safety and efficacy. And we know that a lot of, which species, a lot of times you'll see stuff labeled like this: devil's claw, devil's dung, diabetina, that's the diabetes remedy, and that's it. We don't get a genus and species name. And often there's one, I'm blanking on the name, but it's called cat's claw, Uña de gato, is that name, that common name, it can be used for several different plants that are completely unrelated. One of which is being studied in South America for what's the word? It's for cancer fighting properties, basically for immune system support. But there's an Uña de gato that you'll find in the Botanica is also, that is an acacia, is a particular kind of thorny tree that has derivatives of cyanide in it.
Cool.
So it's kind of important to know which Uña de gato you're getting. And if it's not labeled, if it's just labeled Uña de gato, so buyer beware. It's and the other thing about that is about the labeling is that there have been some studies where they've sort of independently pulled off the shelf samples of, say, and let's
Take it to the lab.
yeah, and take them to the lab. Let's take something more common or like St. John's wort or something, which actually does have. That's one of those herbs that, not specific to diabetes, but for depression, moderate to mild depression, actually has some pretty robust evidence for efficacy. But a problem is, we'll go and we'll pull 5-10 bottles of St. John's wort, different brands off the shelf that say 500 milligrams, 500 milligrams, 500 milligrams, 500 milligrams, run them through the labs, and we see active ingredients all over the charts. And this has been a particular problem with traditional Chinese medicines, we'll actually see them adulterated. We'll see modern pharmaceuticals added in. They're basically spiking them. And that's happened with the worst cases have been, with some of the worst cases have been with the male potency enhancers and they found they actually have Viagra in them. They're sold as herbal supplements, but they're not. I'm running out of time, but I want to hit another thing. The other reason this stuff is important, I believe, is these aren't just old wives' tales or things that only happened in the past. They're still very much with us. There are what we call culture-bound syndromes. I don't really like that term either, or folk illnesses, whatever, but things like empacho, which is a gastrointestinal, mal de ojo, susto, which means fright. These things are still very common. These are 100 primary care patients, and we just ask them, hey, has anyone in your family ever had this? And 60%, or did they themselves ever had it? Why do I bring this up in the context of diabetes? Well, if I were to ask you, well, what caused your diabetes? Most people, well, I don't know what you guys would say, but I'm going to guess susto wouldn't be at the top of your list. Okay, you wouldn't go, oh, susto. But when we asked folks in our primary care clinic here in South Texas, we got a lot of this. We got a lot of people saying, sure, I had 2 accidents at work, and that's when the problems began. I was fixing a tire, it blew up in front of me, I had an injury. Another one, I saw a child drown. And these are very traumatic events. It had a susto. And then, now, obviously this is probably, some event, maybe that's what sent them to the hospital, and that's when they found out they had diabetes, so sure. But the implications are significant. So I actually looked at medication adherence and depression among the patients with diabetes who attributed it to susto versus those who said, nah, susto didn't have anything to do with it. What are you, crazy? And the ones that said, yes, my diabetes was caused by susto did tend to have higher depression scores and poor blood sugar control. So by asking the question, it could potentially be a flag. Oh, there may be some other things going on here. And I'm going to just wrap this up because I have a lot more, but we could talk afterwards if you want. But if there's one thing I did learn that's really valuable, that was super valuable from the traditional healers, both in South Texas and in Mexico, is what they are really, really beautifully attuned to, is that when somebody gets sick, when somebody has diabetes in particular, the emotional state, whether it be susto, whether it be, is profoundly important in the treatment path. And that if you don't, and the other thing is, it doesn't just affect you. I mean, it affects your whole family. It affects your work life. It affects your entire social and familial context. And if you don't address those, and the traditional healers are really attuned to this. I have a lot of stories where they went straight. I had one diabetic patient come in, and the healer said, what's your problem? And the only thing that came out of her mouth was, I'm having some trouble with my blood sugar. And she scooted the chair, pulled her up, grabbed her hands in her hands, looked her in the eye and said, I'm going to give you some plants that'll help with that. But that's not what's working. I was translating this for her, and I said, oh, this will be interesting. What's this? And she said, you don't feel like you have enough love in your life. Immediately, the patient starts just crying. Just the waterworks, she opened up. And it was beautiful to watch, because and I don't know what she picked up on, but she realized that, yes, it's the diabetes, but it was what all of that was causing at home. And so she gave her these beautiful practices of basically visually, I want you to go outside in the morning when the sun comes up, I want you to hold your hands up, and I want you to just visualize love raining down on you. Now, we can get into clinical studies, and does that really make a difference? But I can tell you, that woman left with this beaming smile on her face. And if anybody's going to be more compliant with their meds and more willing to dialogue with you to take those empowering steps, it's somebody who feels like they've been touched that way. So that was something that I really learned, and that's, to put it back in San Antonio, I mean, that's kind of what we're hoping to do with the Body Adventure, is just kind of create this space where you can come and have fun with the family, and it's non-threatening, it's not scary, but then go back and be a little less afraid in the clinical environment. Are there any questions? I know I'm out of time, and I apologize. Thank you so much for staying so late in the afternoon.
Are you going to put your things up on the
Yes,
thing?
yes,
Okay.
absolutely.
Good.
Yeah, and because I have a couple websites that you can check out. And yeah, it'll have my.
Thank you.
And feel free to contact me. It'll have that info on there.
Okay, what's the exact translation of susto?
Susto?
Fright event? Okay.
Fright. It's kind of a startle fright.
Yeah. That's what I thought, but I wasn't sure.
All right, and that concludes
I
today,
wouldn't
day
scare you,
2.
so I figured
Tomorrow,
that's
day
what
3. Make sure you turn in all the paperwork, and drive home safely, and we'll see you here tomorrow morning at 8 o'clock. Thank you.
All the memories. Rainy afternoons, swinging Harlem too, motor trips, burning lips, burning toast and food. I love the way it was. Thanks for the memory of candlelight and wine, castles on the Rhine, the Parthenon, and moments on the Hudson River line. How lovely it was.